Lung cancer, as you may know, is still the deadliest form of the disease in the U.S. However, according to the American Lung Association, the survival rate has increased, and it's increased significantly. According to a new report, 26% of those who get lung cancer survive at least 5 years past that initial diagnosis. That's up almost 5%, but more people still need to get screened. And for more insight on the importance of lung cancer screenings, we're joined this morning by Chair of Radiation Oncology for Corewell Health, Dr. Craig Stevens. We're so glad you're here with us today.
Good morning. Thanks for having me.
Talk to us a little bit about overall, how important are these screenings? I feel like in the last year or so, we've heard a lot more about the push to get more people screened and screened earlier.
Yes, lung cancer screening is really important. Lung cancer, as you mentioned, is a very deadly disease, and it was only in about 2011 when we first realized that low-dose screening CTs could have a big impact on lung cancer diagnosis. We've since found that people just getting screened for lung cancer have a 6% higher survival at 5 years than people of a similar age that aren't screened. So screening saves lives. It makes people live longer.
Yeah, I mean, if you do that simple math, right? So who is eligible for a screening? Can anyone just walk into their doctor and say, I want to be screened for lung cancer?
Well, if they want to pay for it, they can. If they want their insurance to pay for it, they have to meet certain guidelines. And the American Cancer Society just came out with new guidelines. Very simple, 50 to 80 years old, and smoked for 20 pack years. 1 pack a day for 20 years, half a pack a day for 40 years, 2 packs a day for 10 years.
Is it either or? Is it 50 and older or smoking?
No, both.
No, both. It is, okay, so you have to actually meet both of those guidelines in order to be eligible for the screening that insurance covers.
Exactly.
Otherwise, you're paying for it out of pocket.
But it's only $50.
Okay.
So it's not that expensive, even if you want just the peace of mind.
So it's minimal.
I think for people that have smoked a lot in their lives, it's not unreasonable to do. Our data hasn't caught up with, I think, where we're going to be in 5 to 10 years. But today, the data strongly supports active screening for people that are 50 to 80 and have 20-pack year smoking history.
Okay, so when you talk about this type of screening, what's the process like?
The way we do it at Corewell is that you talk to your primary care doctor, and your primary care doctor looks at your risk factors, talks to you about pros and cons of screening, and then simply orders a low-dose screening CT scan. The process, there's no IV contrast, so there's no needles.
Okay.
The process takes probably 15 minutes in the Department of Radiology, and you're done. And several days later, you get the report.
So for those who are non-smokers, I'm sure they have a lot of questions as well. Do you talk to your doctor about getting screening? Do you forego? Do you wait until you turn 50? What should they do?
Well, for never smokers, there's no data. There are no criteria that suggest you should be screened. But for people that have a strong smoking history, those are the ones that we really, really want to have screened.
Okay, and so if someone is watching this and they think, okay, I can benefit from getting a screening, what's the first step?
The first step is talk to your primary care doctor. And if you don't have one, certainly you can call the main number at Corewell Health, and we can find you one.
And we've talked a lot about screening. How important is early detection?
It's critical. Early stage lung cancers are very curable. More than 95% of early stage lung cancers are cured. However, with late stage lung cancers, that's not the story. And lung cancers can get quite large and have no symptoms at all. People have a lot of excess lung capacity. We're sort of designed to hunt gazelles on the Serengeti, and you don't have to use the same amount of lung function to go through the drive-through at Burger King. So people don't bump into the top of their lung function that often in our regular American life. And so there's really no symptoms often until the tumor's quite advanced. That's why annual screening is so important. It's not one and done, it's annual screening.
Yeah, and those new numbers are certainly staggering. All right, well, we appreciate it. Dr. Craig Stevens, thank you so much for joining us here this morning.